Hello and welcome to Shoop Surgeries. How may I help you? You're here for an appointment. Could I get your information, please? Your name, please. Yes. And your last? Could I get your DOB? Date of birth? Yes. Yes. That would make you... Of course. Yes. And your address? What town is that in? Okay, I am new here, so I am still learning how to do things around here. Hopefully it won't be too much of a problem. Do you know what you are booked in for? Okay, general checkup. Yeah. Okay, and you also requested a cranial nerve exam. Okay, I'm assuming that isn't some sort of surgery. No, okay. I assure you I know what I am doing here. Okay, Dr. Shoop is actually seeing somebody right now, so if you'd just like to hang on just a few minutes while he finishes off with his latest client. Patient? Yes, of course, patient. Yes. I'm sorry. Oh, I've worked here for 3 days. Yes, hopefully this won't be my last day. Oh, this is just my it's like a guidebook. It's got all the things I need to say. Yeah, I have to use it a lot. I don't remember things so well. Maybe I should get an exam. Yes, I'm scared of doctors, so I know I work in a doctor's surgery, but I was told that working here might help me get over my fear, but Dr. Shoop scares me. No, he's not a horrible person. He's just a doctor, and that scares me. Oh. Yes, it looks like the doctor is ready to see you now, so if you would just like to go through those doors, he will be there waiting for you. Hello, my name is Dr. Shoop and welcome to my surgery. it says here that you have come for just a general checkup today and a cranial nerve exam. Okay, well, we don't have all of the equipment here today to perform a full cranial nerve exam, but we will make do with what we've got, and we will book you back in and let you know when all of the equipment is here. We have recently just moved into a slightly more advanced facility, but we're still in the process of bringing our equipment over. But we will, as I said, perform a cranial nerve exam and a general checkup with the equipment we have available here today. Okay, so what? Oh, the receptionist. Yes, he's an odd one. I don't know what's wrong with him. I found him hiding in a cupboard one day. I have no idea what's wrong with him. Maybe he's just trying to, I don't know, break into the role. Anyway, can I just confirm a few details with you? Your name? Yes. Your date of birth? Yes. Oh, the receptionist called it Dob. Yes, he's done that a few times. Address? Okay, perfect. Okay, we will start with a general checkup today. We have managed to get a hold of some very advanced equipment. We're one of the few places that carries these. We no longer need stethoscopes. We use this little piece of tech. It is an all-in-one, so it has all of the information we need, and it also carries out a few of the procedures that we use with checkups. So, to replace the stethoscope, we simply hold it to your chest and it monitors your breathing as well as your heart rate. So if we pull that up now, I will just press this gently on your chest. Yes. Now just breathe gently for me. Yes, in, deep. Yes, and out. Yes. One more time for me. Yes. Okay, your breathing is just fine. Your lungs are working perfectly, so there's no problem there. What we will do is check just to make sure your heart rate is normal, or what we would consider normal for just everyday standing around visiting a doctor. So I'd like to just ask you a couple of questions. Do you have any known heart defects? Not that you're aware of. Okay. Any heart disease in the family? Just your uncle? What was that, do you know? Right. Okay, so we will just check your heart rate. We hold it here for 10 seconds. Looks like it's done already. You must have a nice strong heartbeat. Yes, you do. Your heart is absolutely perfect. Okay, so you have nothing to worry about here. Okay, so let's move on to your sight. Okay, we have a couple of different things that we're going to use today. I don't have my charts, so I can't do a routine eye exam today, but that will be included next time you visit us. And like I said, we will let you know when that will be ready. We will set that up for you. But we can use a pen. So if I just place this down here. Yes, we live, of course, close to the seaside, so seagulls are about. So we will just see how your eyes are working with your brain. So if you just like to follow the pen, do not move your head, just track it with your eyes, okay? Okay. Yep. Okay. Okay, we'll go up and down now. Remember, follow only with your eyes. Just with your eyes. Yeah. Okay. You're looking all right there. Just do it one more time. Yeah. Yeah. And up and down. Yeah. Okay, that's perfect. Nothing wrong there at all. Now what I would like to do is just stick my pen back into my pocket, and then we will go ahead and check your peripheral vision. So for this exercise, I would like you to just follow my fingers and let me know when they disappear out of your view. Okay? Yes, perfect. Perfect. Okay. We will come back towards your vision. Let me know when they come into your vision. Start right out here, and then we will come in slowly. Yes, that was great. Let me do it one more time. And we'll bring them back together. Yes, that was great. Nothing to worry about there. Okay, just a few hearing exercises. Don't worry, we're not going to do anything evasive. But what I have is a card. This is my business card. You will get one of these at the end of the session. It has some information on here that you can use to get a hold of me at any time, and some useful, helpful information that can help you in your everyday life. What I will do is tap on the card in either your left or your right ear, and I would like you to tell me on which side you hear it. Good. Okay. Yes. Perfect. Now, I tried to trick you, but you figured it out. Fantastic. Okay. Yeah. Okay, now, where's the sound coming from? Yes, down the middle. Okay. Okay, that's perfect. We have nothing to fear there. So, we've checked your lungs to make sure your breathing is fine. We've checked your heart and there is nothing wrong there. We've given you a brief check with your vision. There is nothing to fear there, and we have given your hearing a very quick check, and again, there is nothing to fear there. But I would just like to get a quick picture of your eyes. This is the same sort of thing that your regular optician would do. Yes, just to put it on record for us, it's not easy for us to communicate with the opticians, so we tend to just have files of our own. But again, with this piece of tech, you won't be submitted to looking at the balloon in the distance and then a bright light. This will simply scan your eye and take a reading from within. It's really, really clever stuff. Okay, so just hold on. Yes, it's building an image right now. Yeah. No, don't. There's no lens. It uses small waves of sound. But okay, hold on. It uses small waves of sound, extremely low frequencies, to it's a bit like what happens when you get your checkups when you're pregnant. Same sort of principle, but for the eye. Rightio. Okay, so your left eye is looking clear, and your right eye. Do you need glasses at all? Only for reading? Okay, that completely explains that. Yes, we can take a rough estimate of how your eyes function as well. So there's nothing to fear. Your eyes are looking fine. Nothing out of the ordinary. Okay, let me just have a quick check of your ears to make sure your ears are alright, but this will just be a manual check because it will allow me to see right down into your ear canal. Okay, are you ready for that? Okay, awesome. Right, so yeah. Okay. Right, that is fine. Okay, your ear is fine. Your ear canal, from what I can see, is perfectly alright. You seem to be maintaining your ears fantastically well. Here I have a little model of an ear, the pinner. Granted, it's a little small for an ear. So I have seen a slight abnormality in your pinner. Nothing serious, and it's not going to cause any problems, and you might even be aware of it. But your pinner is slightly pointed towards the end. Now, it doesn't change the way you hear, really. The pinner is here to funnel sound into your ear canal because of the way it's shaped. So all sound is directed straight down towards your eardrum. But yours is slightly pointed. It's always been like that. Well, I kind of guess that we don't tend to grow different shaped ears unless, of course, we go in for some sort of cosmetic surgery. So you're already aware of your ear. Okay, so did you know only one of your ears does it? Yes, only one of your ears does it. Don't worry, that's completely fine. My mother's ear is also like that. I don't know how rare it is, but you know, a routine check on your eyes, your ears, your breathing, your heart. Everything is completely fine. You are completely healthy, and I am 100% satisfied that you can walk away here knowing that you are in good health. Like I said earlier, we will get all of the equipment down here so we can perform a full checkup on you. We will make the arrangements for you, and we will phone you up to confirm a time that best suits you. So if you'd just like to head off, that way the receptionist will deal with you and we'll get you on your way. So thank you for visiting the surgery today. Here is the card that I told you about. It's just got a little YouTube link on the bottom. It takes you to a YouTuber that will help you just with mindsets, and of course with being YouTube, you'll be recommended people just like him, so make sure to check them all out. So that is yours. I'll just, there you go. Or you can drop it. Yes. We'll try that again. Maybe we'll check your movement next time. Yes. So I will see you very soon. Yes. Have a good day. Have a good day. Hey, you're back. So how was it? Okay, good. That's good to hear. So I think I have to check you out now. No, don't worry. Not in that way. So is that all we can do for you today? Okay, so we can check you out. Okay, so is there anything at all? Okay, so he said we will book you in when all of the equipment has been moved down to this facility. Yes. Okay, so can I get your phone number? Okay. We will call you when everything is set up and ready, and we will perform a longer routine checkup for you, as well as an eye exam, a cranial nerve exam, and hearing exam. Yes. Okay. So I would like to thank you for visiting the surgery today, and have a pleasant day. You can go now. Or just stay there. I don't mind. You know what? I think I have to go somewhere now. Where's that cupboard?